Hypertension pathophysiology. Type of hypertension discussed in previous video. Type primary hypertension and secondary hypertension. Now we discuss in detail the pathophysiology of primary hypertension or essential hypertension. It mostly occurs in 25 to 50 year age group which have positive family history. Essential hypertension have no underlying cause why it occurs. Increase the sympathetic nervous system activity, which increase the production of norepinephrine and epinephrine. It act on heart, vessel and kidney. On heart is increase the heart rate and increase the stroke volume. That increase the cardiac output, ultimately increase the blood pressure. On vessels, it cause vasoconstriction, that increase the peripheral resistance and increase the blood pressure. In kidney, JG cell increase the production of renin, that increase the conversion of angiotensin 1 to angiotensin 2, increase the angiotensin 2 and cause high blood pressure. And second is increase RAS activity. Mostly it is seen in type 2 diabetic patient and obese patient. Increase the renin production from JG cells, increase the angiotensin 2 and that increase the blood pressure. We discuss the mechanism of angiotensin 2 later. Third is increase the sodium retention, that increase the reabsorption of blood and reabsorption of water and increase the blood volume, that cause the high blood pressure. And the JG cell detect the increased blood volume and that decrease the renin production. That is common in African Americans. Fourth is increasing age group. Increasing age group decrease the elastin and increase the collagen, that cause the loss of elasticity and of the blood vessels and low the compliance of blood vessels, that increase the blood pressure. Hypertension for risk factor for primary hypertension is increasing age group, increased insulin, alcohol consumption, stress, smoking, increased weight, increased sodium diet, increased low density lipoprotein and triglyceride, and decreased activity. Now the pathophysiology of secondary hypertension. Secondary hypertension seen mostly in less than 30 age group. It is sudden and severe. First cause in renal cause. In renal cause, renal vascular cause, that is fibromuscular dysplasia. That is it is progressive twisting of blood vessels that decrease the blood flow in the kidney, or renal artery stenosis, that also decrease the blood flow in the kidney. JG cell detect and increase the production of renin and increase angiotensin 2, that increase the blood pressure. Secondly, disease of kidney tissue and the smaller vessels, that is diabetic mellitus nephropathy, discussed in diabetes series, and polycystic kidney disease or glomerulonephritis, that all decrease the GFR, and decreased GFR increase the production of renin, and renin increase the angiotensin 2 activity. Angiotensin 2 activity, where act the angiotensin 2? It acts on blood vessels, adrenal gland, and increase the act on posterior pituitary, increase the production of ADH. On blood vessels, it cause vasoconstriction. In adrenal gland, they increase the production of aldosterone and increase the sodium retention, that increase the water reabsorption and increase the blood volume, that ultimately cause the increased blood pressure, increased ADH, that the increase the reabsorption of water, and increased blood volume, that is create the high blood pressure. Second is drug related causes, sympathomimetics like cocaine, NMDA, amphetamines, PCP, that increase the heart rate and stroke volume, that increase the cardiac output and increase the blood pressure. And second mechanism is increase the peripheral resistance and increase the blood pressure. Oral contraceptive like estrogen. Oral contraceptive act on liver, that increase the production of angiotensinogen, and that angiotensinogen convert the angiotensin 1 to angiotensin 2, and that increase the blood pressure by occurring these mechanisms. NSAIDs. COX-2 inhibitor. COX-2 inhibitor decrease the PGI2 activity, and PGI2 helps the afferent arterial dilation. If PGI2 is decreased, then afferent arterial vasoconstriction occurs. Decrease the blood flow to the kidney and decrease GFR. Decrease GFR cause the production of renin, increase the production of renin, and renin is increase the activity of angiotensin 2, cause the high blood pressure. Decrease GFR also the increase sodium retention and increase the water reabsorption and increase the blood volume, that cause the high blood pressure. Now the endocrinal cause, hyperaldosteronism, increase the aldosterone production increase, and they cause sodium retention, and sodium retention is increase the reabsorption of water and increase the blood volume, that cause increased blood pressure. In Cushing syndrome, the high cortisol level, that increase the heart rate and stroke volume, and also increase the peripheral resistance, that increase the blood pressure. In pheochromocytoma, increase the epinephrine or non-epinephrine level, they cause this increase the sympathetic activity. It cause increase heart rate, increase stroke volume, increase total peripheral resistance, and increase the blood pressure. Hyperthyroidism, increase the thyroid hormones, that act on heart beta receptor, increase the heart rate and increase the stroke volume and increase the cardiac output, that increase the blood pressure. In hypothyroidism, decreased thyroid hormones, increase the total peripheral resistance and increase the blood pressure. Hyperparathyroidism, increase the PTH hormone, that increase the calcium level, and calcium level increase in smooth muscles, cause the increase total peripheral resistance, and that cause the increased blood pressure. Cardiac cause. Coarctation of aorta. Coarctation of aorta means narrowing of large blood vessels like aorta, that cause obstruction. In coarctation of aorta, the proximal blood pressure is presents with increased proximal blood pressure and decreased distal blood pressure. Due to the obstruction after the arteries that supply the brain or head or upper extremities, so the high blood pressure in the upper extremities and head, and after supplying the coarctation is present, that decrease the blood pressure in distal part or lower extremity, and also decrease the blood flow to the kidney. So kidney produce increase the production of renin, increase the activity of renin angiotensin 2, increase the blood pressure. Pulmonary cause, obstructive sleep apnea. Don't discuss much more about it. In obstructive sleep apnea, decreased O2 and increased CO2 level that cause increased sympathetic system and increased oxidative stress, and also increase the inflammation, that all cause the increased blood pressure. In neurological cause, sixth neurological cause, increased increased intracranial pressure due to the increased blood or any brain mass or abscess, or increased fluid in brain like edema, that cause the increased blood pressure. In pregnancy, we also not discuss in much more detail. Preeclampsia and eclampsia, both or occur after the 20 weeks of pregnancy, and both show high blood pressure, both show proteinuria and proteinuria. But the main difference from preeclampsia and eclampsia is, in eclampsia presence with seizure. That is the main difference between preeclampsia and eclampsia.